about compression bandaging, okay? There's lots of different kinds out there. What I'm going to use now is probably the oldest one. It's called Unna boot. Okay, an Unna boot is basically a piece of material that is impregnated with some sort of either zinc oxide. This one has calamine. That's what makes it pink. Some of my patients would prefer the calamine because they said the zinc by itself would get itchy. Okay, so we would go to this one most often. When you put this on, it's not going to give. And that's what I was telling y'all. You don't want something that's going to stretch, but you want something that doesn't give. You have to be a little careful with this, and oftentimes I would put an ABD pad or something right there where there might be friction. But you have to be careful when you put this on, because as it dries out and they move about, if their skin is real sensitive, it could create some sores and things. And I always tell them, if it starts sliding down, I call it distal drift. If it starts sliding down the leg and starts cutting in, then they need to cut it off and not worry with it, okay? All right, so I'm gonna show you how I would wrap this on here, and then we'll do a couple others. All right, so I would start here at the foot, and I know it's cold.
It's not too bad.
And what I like to do is get the whole leg kind of covered. And I like to go up at an angle, because if you just go round and round and round, I feel like the flow goes better when you do it at an angle. Because then what I'm going to do here is I'm going to come in a downward angle. And you're going to be less likely to get that drift and the cutting into the tissue if you do it at an angle. That makes sense?
Yes.
Okay. And then I'm going to go back around the foot. And because your leg is so small, it's going to keep going. I've had some patients where I have to use 2 of these rolls. Their leg is so big. You're going to have to go to the bathroom and wash this off. And then I would cover this with Coban, just because this is very messy now. And we need something to cover it and kind of keep the messiness in. I would also put shoe covers over the foot, because if I don't, they're going to leave footprints out in my clinic. And that's happened before. So, and the good thing about this is you can move your ankle, okay? And it's not going to constrict in on her. It's going to stay right where it is, and it's going to prevent further swelling, and as she moves about, the muscle pump is going to push against that wall, and it's going to help facilitate the movement of swelling. And they could put this on and leave it on for 7 days. Okay, pending any adverse reactions, it's sliding down, pain, anything like that. Okay, so that's one option.